Okay, hello everybody. It is day 16 of our nursing school mindset edit. So I'm super excited that you're here with me today. Today we are going to be talking about pharmacology and some ways to kind of get prepped for this class, okay? So glad you are here, Chanel. Hi there. Okay, you guys. So a big mindset problem that students have is that they go into classes with this preconceived notion based off what other people have said, what they've seen on social media, or just their own maybe uncertainty about a class, and that leads to fear, right? And it leads to a lot of negative self talk and a belief that things are going to be impossible. And the class that most students think ahead of time before they even get into it that they think is going to be impossible is pharmacology. Okay, so the first thing I want you to do as you shift your mindset is just try right now to stop thinking that pharmacology is going to be impossible. Okay, you don't know until you get into it how you are going to do in this class, right? And people love to complain about things that they find challenging. So, of course, that's amplified out there, right? So think about why you're having these thoughts about pharmacology. Is it because you're in it and it really is hard for you? Or is it because of someone else's perception? Okay. I would say if you can reserve judgment for all of nursing school, like wait until you get into the program, wait until you get into the class, reserve judgment until you have your own experience. Okay. And then this is going to carry over to your work at the bedside. I cannot tell you how many times I have gotten a report on a patient and the nurse has painted this horrible picture, or even just reading through the chart, I'm like, oh my gosh, this is going to be a nightmare. I really try to reserve judgment because 90% of the time, the experience that I actually have with the patient is completely different. Okay, so just try to get into the habit of not jumping into a belief before you actually experience it. Okay, you'll save yourself so much stress and time. So, if you do struggle with pharm, my best advice is do not wait to take action on that. Okay, if you keep studying in the exact same way after you've had a poor performance, that's the quickest route to having another poor performance, right? So you have, and this goes with any nursing school exam or class that you're taking, identify where things kind of fell apart, and then you have to make adjustments. You have to make course corrections. You're basically applying the nursing process to your own education, right? You are assessing, like, look back. What did you do to prepare for this exam or whatever it is? And then diagnose. That's the next step in the nursing process. So diagnose the problem. Like, what was the issue? And then P, you're going to come up with a plan on how to do things differently. I is intervene in the nursing process. So then you're going to actually do your plan. And then E is to evaluate. So again, you circle back and evaluate, did that work? Did I do better on the second exam, etc. Okay? So I like to use the nursing process just in everyday life as well. It really is handy. So when you're looking at maybe your past study methods and maybe a less than stellar performance, be really honest with yourself about what might have gone wrong. Were you really focused on memorizing? Students feel like they have to memorize all these drugs and spend less time than they should on understanding drug classes, core concepts of pharmacology. Maybe you are a very visual type learner, and instead of relying on that, you tried to read your textbook word for word and fell asleep halfway through it, right? So that wouldn't be working for you. Maybe you spent hours making flashcards, but you didn't have time to actually utilize and go through the flashcards. I am making an app for you guys that will take that problem off your hands completely. Did you do practice questions? Did you review the objectives? Like, look back, analyze what you did, what went wrong, apply the nursing process. So let's talk about some tips for preparing for pharm. So let's say pharm's coming up for you And this is not a class that I would just walk into and without any prep. I'm not saying you can't enjoy your break, but doing a little bit of prep is going to start you off on the right foot, okay? So you guys took your prereqs for a reason, right? They made you go through that for a reason, and that is because those prereqs are your foundation for everything that you learn in nursing school. And pharm is no exception. So I want you to review some anatomy and physiology, which I talked about at great length the other day, especially if anatomy and physiology was a while back for you. It could be several years back, right? So going and looking at just a few key things from anatomy and physiology can help you understand some concepts in pharmacology, so you'll feel like you're getting it on those concepts. That's huge for boosting your confidence for learning other concepts as well, okay? So the RAS pathway, you want to know that forward, backwards, sideways, and diagonally, okay? Know that pathway, understand everything that happens. There are a handful of medications that are going to act on or disrupt that pathway. And you don't have to memorize a darn thing about those medications. All you have to know is the RAS pathway. So I talked about this the other day, where we talked about memorizing versus conceptualizing. And if you memorize the RAS pathway, okay, so just memorize the components of it, right? Renin, angiotensin, aldosterone system. Then you can start learning the concept behind RAS, right? And then you can apply that to a bigger concept, which is many of these drugs in pharmacology. So RAS pathway, know that one, you guys. Take a look at the autonomic nervous system. And if you're in my boot camp, I go over this with you so that you don't feel like you're starting from scratch. So the autonomic nervous system, really helpful for understanding medications that are going to interact with the sympathetic, parasympathetic nervous system. And there's a bunch that do that. And that's a trickier concept, so I want you to review there. Take a look back at alpha and beta receptors. Lots of meds are going to stimulate or block these alpha and beta receptors. So knowing what these receptors do, you'll pretty much have an idea of what the drugs that affect them do in the body. So a lot less memorizing of drugs, way more understanding the concepts. Like a great example is metoprolol, which is a beta blocker, and phenylephrine, which is an alpha 1 agonist. So if you know nothing else about phenylephrine besides that it's an alpha 1 agonist, you're going to know that it's going to cause vasoconstriction, and then that's going to cause blood pressure to go up, et cetera, okay? Another thing to review that students have a hard time with, and I get it, this is a tricky concept, which is why I cover it in boot camp for you guys, cholinergic agonists and antagonists, okay? So those cholinergic agonists are going to be used to treat things like Alzheimer's disease, is where you're going to see it the most, while anticholinergics treat things like bradycardia, like atropine is an anticholinergic. You'll see scopolamine used for motion sickness, bronchospasm is treated, et cetera, et cetera. So there's a bunch of medications that kind of follow down with these cholinergic agonists and antagonists, okay? And I want you to be able to keep them straight. And then acetylcholine receptors, those muscarinic receptors, those nicotinic receptors, take a quick review of those. If you understand the difference between those muscarinic and nicotinic receptors, then you'll have some key background knowledge that you can use to understand how these types of drugs work and what side effects they're likely to cause, okay? The other ones, there's two more that I would say review: neurotransmitters. So having a general understanding of key neurotransmitters and what they do is going to be super helpful for understanding a whole slew of medications like norepinephrine, dopamine, serotonin, epinephrine, all those kinds of things. So take a look back at your neurotransmitters, and then diving even further into the endocrine system and feedback loops. So make sure you understand how feedback loops work. The most common type is a negative feedback loop. So a perfect negative feedback loop to kind of review is that thyroid and the thyroid stimulating hormone. Like that feedback loop is just a great classic example of how that works. There are some positive feedback loops in the body. Most of them are negative feedback loops. So go through that, maybe look at some key hormones from the endocrine system. I would say like aldosterone, norepinephrine is another one, the thyroid hormones, things like that. It'll give you a little bit of a leg up when you head into pharmacology. Okay, so that's your review section, you guys. If you find that you have some extra time, then you can review suffixes, roots, like drug names in certain classes will share some naming conventions that are pretty standard. There's often these one-off ones that don't quite follow the naming convention, but for the most part, you'll have a really good idea of what the drug class is for a drug simply by looking at the name of the drug, like metoprolol, right? Olol, O-L-O-L, that's a beta blocker. I don't have to know metoprolol specifically. I just have to know that OLOL is a beta blocker and no beta blockers. And now I know metoprolol, I never can say this one, propranolol, all the olols, right? You know, like a bunch of different drugs just by learning one concept. So take a look at common drug suffixes, word roots, all those naming conventions. And I do have a free little download guide for that. I will link to that in the description of this video so that you guys can go and grab that, okay? And then the other thing that students get kind of mixed up on initially, just because it's a little confusing, is that there are two types of drug classes, okay? So I always say learn your drug classes. When I say that, I'm mostly talking about pharmacologic drug classes. There are also therapeutic drug classes, okay? So the pharmacologic drug classification, that's going to tell you like why a medication works in the body, how it works in the body. The therapeutic classification, on the other hand, is going to more tell you therapeutically what it does, okay? So a great example of this is metoprolol, that beta blocker that we talked about. That's its pharmacologic classification, beta blocker. So you know that it's going to, slow the heart rate, et cetera, et cetera. It's also in the therapeutic class of an antihypertensive. So you can see how you can learn things about the pharmacologic class, and then you can learn things about their therapeutic class, okay? And then to be even trickier, I have come across some drugs that don't really have a pharmacologic class. They just have a therapeutic class. So if this is kind of confusing for you, it's okay. You're not the only one. But if a drug is in a pharmacologic class, learn what you can about that class of medication, okay? And that is it. Those are my tips for prepping for pharmacology, okay? Oh, Deborah, you're talking about a positive feedback loop, I think. Oxytocin for labor and lactation. Okay. And then Keith says perfect timing. Okay, Keith, I'm so glad. I hope that is helpful for you. And Jesse says, when can we see the app? Oh, Jesse. Okay, so I don't know if you heard, I had to scrap everything and start over. So that was a tough decision to make, but I did not want to come out with an app that was going to cause you guys frustration. Looking at how much frustration I was having with the development, there's no way I wanted to wish that on you guys. So I scrapped that project, went with a new development team. Mega excited about it. If you're on the app waitlist, Jesse, you're going to get an email, I think tomorrow, with some screenshots. So a little bit of a sneak peek there. I'm really hopeful for this fall, okay?